Hello, my name is Cassandra Snyder-Wyatt. Today I'll be showing you how to do tracheostomy care and trach suctioning. I'm an 8th semester nursing student here at Lincoln University. And I've already gathered all my supplies. I have a trach suction kit here. I've got a trach care kit underneath. I have me a pair of sterile gloves, and I've got a towel. So at this point I would go ahead and come into the room. Hi, my name is Cassandra. I'm going to be your nurse today. I would provide the patient with privacy. However, for this video purposes, I'm going to keep this curtain pulled back because all my suction tubing and oxygen tubing is back here. At this point, I notice and I'm assessing the safety of the room. This patient is a new tracheostomy patient, so she needs an obturator and a smaller size tracheostomy somewhere in the room that is accessible. Hers is taped to the bedside. So I've introduced myself. Can you go ahead and tell me your name and date of birth? She would tell me. I'd verify it with her wristband, and I'd let her know what I'm going to do today. So, hi, Miss Opal. I'm going to go ahead and do your trach suctioning and trach care. So that, if that's okay with you, she would respond. I would want to make sure that I assess this patient to ensure that she did need to be suctioned. So I would listen to her lung sounds. Likely they're going to be crackly. Probably some rhonchi in there, any kind of adventitious lung sounds that would indicate that she has some kind of secretions in her bronchioles would be what I'm looking for. I can tell that she's having a little bit of a hard time breathing. She's a little bit tachycardic. Her respirations are about 26 a minute, and she's having a hard time clearing those secretions on her own, so I know that she needs to be suctioned, and I can kind of see some secretions on her inner cannula. So I'm going to go ahead and get ready to suction her. I'm going to put my towel down. That way I don't get her secretions on her. Alright, and then I would turn on my suction to between 80 and 120 millimeters of mercury, and I'm going to hyperoxygenate my patient. I'm going to make sure my suction tubing is here on the bed, ready for me to grab. I'm going to raise her up to working height. I would also ask the patient if they were able to take a couple big, long, deep breaths. 3 to 5 big, deep breaths will help oxygenate them to the point that I'm needing them at. We're just hyperoxygenating them because as I'm suctioning, I'm going to be pulling some of that air out of their, where they have it. I'm going to be pulling some of their air out of their lungs. So we want to make sure that we hyperoxygenate them so that we're not causing them any kind of distress. I want to make sure that my patient knows that we have some kind of signal. So Ms. Opal, if you are in any kind of pain, distress, if you feel like you just can't breathe, I want you to raise your left hand. She would tell me okay, nod her head, communicate somehow with me. So at this point, I would want to go ahead and perform hand hygiene. I'm going to grab my suction catheter tray. I'm going to pull this a little bit closer. I'm going to grab my suction catheter tray, remove my trash can, perform hand hygiene again. And I can open the suction catheter tray, being mindful of my borders here. So that is open. Now I can open my sterile gloves. I'm going to take these out and throw that away. Okay. I'm going to set this over here for right now. I would just like to note that while I'm suctioning this patient and performing tracheostomy care, I want to be constantly assessing my patient for any signs of respiratory distress that I may need to stop or just hold on for a minute and let them catch their breath. So I'm going to be watching their respirations, their heart rate, and then obviously if they're like pushing my hands away because they can't handle it, then I would want to make sure that I paid attention to those signs as well. So at this point I'm going to go ahead and don my non-dominant hand. Okay. So if I had an issue like I kind of am now to where my sterile gloves are not opening, I could easily go get another pair of sterile gloves. Which I would want to at this point. So I'm just going to kind of put this on. So my glove rolled there. So I would definitely go get me another pair of sterile gloves. Okay, so at this point I am sterile. So I'm going to be cautious of what I am doing. I'm just going to kind of move this to the side so that I don't have any opportunity to contaminate my sterile field. You can use this sterile drape if you choose. I don't want to. I'm going to put sterile saline. Some people may use sterile water. Doesn't really matter, but at this point this is saline. I'm going to put it in this little box here. And I could throw this away. And at this point I'm going to grab my suction cannula. And I'm just going to kind of wrap this around my hand here. Okay, so at this point, there we go. I would, again, I could ask my patient to take a couple deep breaths if I thought that she needed it. I'm going to remove her oxygen, keeping in mind that my left hand is now not sterile. Okay, and I'm going to test my suction. And I'm going to lubricate the tip here. At this point, I can go ahead and go in to her tracheostomy. I want to be very careful not to turn my back on my sterile field. Okay, Miss Opal, I'm going to go in now, and I'm just going to go in until I meet resistance, and then I'm going to pull out just a little bit, about an inch, and then I'm going to twirl my cannula for about 10 seconds is what you want to suction. You want to make sure that you're not suctioning as you're going into the cannula here. So you just spin. At this point, you would give them a break, let them reoxygenate themselves. You would do this 3 to 5 times. So I've done that. And now I can go ahead and take my sterile hand, pull this trach tie, not with the trach tie, the V-sponge. And at this point, I would change my sterile gloves. Throw this all away. For video purposes, I'm not going to do that. Clean up my work area here. That way everything's out of the way. Put this away. Okay, and you could reoxygenate this patient while you're doing this. So then I have my tracheostomy. I would also have another pair, or my tracheostomy care kit, and then I also have another pair of sterile gloves. She's had plenty of time to recover. I'm going to take her oxygen off. I'm going to open up my trach kit. Some trach kits will have a pair of sterile gloves in them, others will not. I'm going to say that mine does not, so that's why I had another pair of sterile gloves at the side here. You're just mindful again that you're not breaking any sterility here when you're opening this up. I would make sure that I put on my sterile gloves at this point. I'm going to grab my sterile field. And you want to keep in mind your 1-inch border. At this point, I can go ahead and set up all of my stuff here. In this box, I have sterile saline and hydrogen peroxide. In one compartment, I'm going to mix the sterile saline and hydrogen peroxide about 50-50. And I could just throw this away. I wouldn't have thrown that away yet. I would actually save that to be dumped into this compartment here. I'm going to open up my peroxide, dump half in there, throw that away. There's extra trach ties. I have extra pipettes. I've got a cleaner there. So I've got my extra V-sponge, which I'm going to set to the side here. Like I said, you want to keep in mind that you've got this 1-inch border around your your sterile field has a 1-inch border. That's what I'm trying to say. Okay, and then that sterile saline that I said I would have actually kept, I would go ahead and dump that in here. This is just completely saline, and this is 50-50. So at this point, I would go ahead and take my non-dominant hand and grab the inner cannula of this tracheostomy here. I'm going to take it out. And then I'm going to put it in the saline and peroxide mixture here. We'll let it soak for a minute. Then I would take my pipe cleaner, and I'm going to grab this, and I'm going to clean it. There we go. You just want to be mindful that your dominant hand is sterile at this point, so do not break sterility doing that. So I'm just kind of cleaning, keeping in mind this is close to my sterile field. So you want to keep this inside of your box here. Okay, I'm going to leave this pipette there, and then I'm going to take this and put it in my sterile saline. Let it soak. And then with my dominant hand, my clean hand, my sterile hand, I'm going to grab this out of my saline. I will tap it a few times on the inside of my saline. And then I'm going to reintroduce this cannula into the patient's tracheostomy. Very carefully, ensuring that I stay sterile. At this point, I'm going to go ahead and come back, and I'm going to put my little gauzes here in my saline, my normal saline. I'm going to let them soak. I would wring them out, because the whole purpose of this right now is to clean the stoma around the tracheostomy. So I'm going to be making, while I'm doing this, I'm going to make sure that I stay sterile. Now I'm just kind of cleaning, ensuring that I don't break sterile field. And then if I was to contaminate my hand, I would get me another pair of gloves and resume care. Okay. At this point, I could take off my gloves, wash my hands, put on a new pair of gloves. I would want to clean up what I don't need while I did that, and then put on a new pair of sterile gloves. So now we're going to say that I'm sterile again. I'm going to put a new V-sponge on. You can let the area around the tracheostomy air dry, or you can use an extra pair of gauzes, an extra set of gauze to dry it around. You just want to make sure that the area around this tracheostomy is dry completely. I'm going to put this V-sponge in, and you have little pipettes here and little Q-tips. You want to make sure that you keep this as sterile as you can as well. To get this under here, which is kind of a pain. You just got to do the best that you can. So I'm going to make my non-dominant hand not sterile. And if you feel like you contaminate sterile field at any point during this process, then you can easily get another V-sponge or another pair of sterile gloves, etc. I'm going to reach over you here, Opal. I'm just kind of moving these trach ties. This side went pretty smoothly. Okay. So at this point, she has a new V-sponge. If her trach ties were soiled or wet or had any kind of secretions on them, I would want to go ahead and change them. They don't for purposes of this video. But if I did change them, then I would want to have another person help me do that. I could reoxygenate my patient. I'm going to put my bed rail back up, put them back down. I'm going to clean up my area. Take off my sterile gloves. Wash my hands. I'm just going to move this in the video. I would go ahead and I would make sure that I grab my towel, just completely clean up your area, put this back in the linens, And then I would make sure that Opal had her call light within reach. The bed rails were up, that I turned my suction off and put her oxygen back down to where it was. Ask her if she needs anything, and then I would go document that I performed tracheostomy care, that I changed the V-sponge. Any kind of secretions that you see during this time, you would want to document that there were secretions, the color, any kind of characteristics, and how much, what kind of amount of secretions that there was. What did I forget?